gluteus maximus all the way to the coccyx tail. And then I finish on top of the coccyx tail and either sides of it. And it's a small bone, so once again, I'm going to bring more scaling and pinpoint technique. After I've done all of that, face to face and face to side, I'm going to flip myself over and I'm going to go face to feet. And I'm going to be pulling everything instead of down and out, it's going up and in. Exactly. So, the one main thing that I would say when you're doing a low back, you really need to see where their low back sits. So this is the spine. Of course, with the spine, we can get kyphosis, which is up top, and that's going to be the curvature forward. And then that's eventually going to create a little bit of that dowager's hump. We kind of went over that when we were doing upper back right prior. Then we have scoliosis, which is a curvature to one side or the other. And then in the low back right in here, that's going to be mostly from rotting out that large intestine in the gut area where it starts to pull forward and protrude. That arching forward is going to create lordosis down here. And so that lordosis is like an inverted spine. She's pretty flush, so this looks good for me. But if I saw that she was, thank you, if I saw that she was inverted, I would just take that like that. I would take a towel or a small pillow, wrap it up, and I would put it into the front of her abdominal pelvis area just to kind of push some pressure to make it more flush, because then you can feel it a lot easier. So we're always going to start off with our nice airplane landing effleurage massage. Then I'm going to begin on the sacrum, playing my angles, windshield wiper, scaling technique, opening the tissue. And I want mid-extension at the beginning because for most people, because like I said, it's tucked in right behind the pelvis. So that's where our like sigmoid hangs out coming down to our rectum. So a lot of old stagnant waste is stuck here. That inflames this area. I'm gonna like 90% of the time, if somebody comes in with a low back issue, spend 15 minutes on their abdomen first and ask them if they still feel the pain. Most of the time they'll say it's relieved because it's the attachment pushing through causing this to be inflamed. But do their low back if they just want their low back tuned out. But the issues are going to completely continue to come back because it's getting rotted out from both sides. You have like an inflammation sandwich going on. And so when I go to do this, I want to go nice at the beginning, extension, kind of layering and shaving it. And then if I feel like they are a little bit overweight and they have a matting over top of that sacrum, I'm going to increase my flexion, get more over top of my elbow because I'll need to plow it and go a little bit deeper. So just if you feel like it's like a rubber mat on that sacrum, you just bring that flexion up. So making sure my hands are warm and nice and clean, I'm going to start with some coconut oil in those hands, make sure it's warmed up. And I'm going to begin with my nice airplane landing effleurage massage. So the fingertips come in, they land. As I put pressure, I come down and around. I grip on those glutes and I come back. And I'm going to do that 3 to 5 times. She told me that her right side feels more tight than the left, and so that means I'm starting on the left. I will run through the left pretty quickly and I'll focus longer on the right because it is the exact same on one side as it is the other. So then just kind of knead it out a little bit with your thumbs. Feel out around those SI joints, and this is the area where you guys are going to start to feel like chunks build up. And so if you kind of put your hands on your SI joints and you go back and forth and flick back and forth and you feel like there's like little balls and softer chunks in there, we know that you have quite a bit of scar tissue around an area that's constantly getting torn because of the like lack of mobility within your low back and hips, causing those constant tears to create these little chunks on top of those little mobile SI joints. After I do a little bit of kneading, palming's nice, so I just put my palm down, put a bit of pressure. I get over top, like I'm putting, Dana can feel the weight of me. And it does feel nice. It helps like kind of like extend, and I'm pushing not just vertically down. I want to be a little bit on an angle, kind of like elongating that low back a little bit. So it is kind of on a diagonal a little bit. And then I just want to rotate that palming just to soften that tissue. Especially if they got that matting going on, it gets them accustomed to the pressure that we will be putting. So I'm starting face to face. If you are not comfortable, this is where I say, like, when you do non-surgical, your body does need to be in like decent shape. If not, it's going to be a workout for you to get in shape, and it's great. It's just you're going to be activating stuff. So you're going to be like, oh, I'm feeling it in my glutes, my low back. Take a minute, stretch out. I do it all the time for myself as well. So as I'm going to do this, I'm going to be from here, face to face, pivoting, face to side. That's all it is. It's just a quick pivot with my hips. And that's the two movements. And then the exact same thing will look like when I'm face to feet and face to side. So it's not like too complicated. It's just, we got to remember that when you go to sit and flip over there, I don't want to see you sitting the opposite direction, still face to face, and then you're coming across your body and you're working like this. Because then I know you're kind of putting tension on your low back and within your QL muscles, and that might kind of set you off a little bit after the treatment. So, start with that effleurage massage, beginning right above the tailbone, coccyx area, right on that sacrum. And I have mid-extension, and I can already feel these little fibers. If I'm quiet, you'll hear it. Because it's right on bone. So it's like fibrous tissue, bone against my elbow, and I'm grinding against it. And it doesn't hurt right now, does it at all?
You're staying on one side for now?
I'm in the middle. That's why I say it gets so tender, because you hit it 4 times. So if you kind of split and kind of hit both sides a little bit, it's okay. But throughout the treatment, if you start to notice it's getting more hypersensitive for your client, back off a little bit. So she's just focusing on her Lionheart breathing, staying in the moment, oxidizing that area. I'm just focused, trying to keep my eyes closed, put your eyes in your elbow, and be that surgical tool pulling the tissue apart. And like, we're in class, I get it, and some of the people that you've like had a good couple weeks with, so you've gotten to know them really well. It's good to be friendly, but when you're doing these treatments, you guys don't really know it that well yet, so you shouldn't be talking too much, and you should be really focused on what you're feeling. And the feedback should just be more so about non-surgical or about what you're feeling. Same thing with the client down on the ground. It's like, oh, did you feel yourself pop over that? Oh, no, I didn't. Go back to that area and see if you feel what I'm feeling. That communication is how you're going to bring your game to the next level. So as I work that sacrum face to face and face to side, then I'm going to start to work my way over, because I'm just pivoting back and forth, face to face, from face to side, and I'm still playing a bit of my windshield wiper, so middle, medial, and lateral, using different parts of a bit of my olecranon, bit of my medial epicondyle, shaving around those joints. Now I'm trickling over to the SI joint, and I'm isolating. So my guide hand goes from like this to like pinching off, to creating a small wedge around that sacroiliac joint to really clean out in the ledges and fosses that I'm feeling.